Continuing with Chapter 8, this PowerPoint will specifically examine the three phonological contrast approaches. These approaches are primarily used for remediating phonological error patterns as discussed with the cycles approach. In last week's PowerPoint, we discussed the cycles approach in detail, so now we have reviewed these top three approaches that are on this slide: traditional, concurrent, and that cycles approach. This week, we will focus on the different contrast approaches, and then the week after, we will begin looking at apraxia of speech and also discuss dysarthria. Phonological contrast approaches are used most frequently when remediating phonological error patterns, but can be integrated or can be used with other approaches, as the primary goal is to increase the effectiveness of a child's communication by establishing those lost phonemic contrasts in a client's speech. So the underlying concept is to focus on words that differ by only a single phoneme. Here the child learns that sounds cause the different meanings of words. Now with this approach, special attention is paid to the distinctly different features or feature contrasts. These features do not play a significant role in the treatment target selection of the other programs that we have discussed up to this point. But within this approach, these contrasts are associated to the differences between sounds or syllable shapes. Now, additionally, within this approach, there are no new treatment procedures, as we're going to continue to use the treatment procedures or those behavioral procedures or principles that we discussed in Chapter 7. Now, the three types of contrast approaches that we are going to discuss in detail are minimum contrast, maximal contrast, and multiple contrasts. All of these approaches use two or more target sounds with contrasting features and are taught primarily in words. So all three approaches use minimal pair word sets. Now, who remembers what a minimal pair is? Anyone? Well, it is a set of words that differ by only one phoneme. Now, the kinds and the numbers of contrasts selected for intervention is what makes the difference between these three approaches, and these differences will now be discussed. So the main criterion for target selection with all of our contrast approaches is contrasting the sound features. When selecting targets, it is preferred for the sound to be in the child's repertoire. Let me say that again. We want the sound to be in that child's repertoire. Remember, with this approach, motor production is not the issue. If needed, the establishment phase of the traditional approach can be used if the sound is not quite established yet. The most common contrasts used are those sounds that are substituted or deleted from the target sound, and the contrast must show a difference in meaning. Let me say that again. Must show a difference in meaning. But it is not imperative to use all real words. Now, if you choose to use a nonsense word, or if nonsense words are needed, then you must establish a meaning to that nonsense word, as was discussed in the chapter when you were going through and reading it. Now, target selection for minimal and multiple contrast approaches use contrasts that are homonymous, as the main goal is to reduce the level of homonymy in the child's speech, but the maximal contrast approach is referred to as non-homonymous, because reducing that homonymy that results between the child's error productions and target productions is not the main goal. Target selection for the minimal approach includes a minimal pair where the target phoneme typically differs in one feature, such as manner or place or voicing from the contrast phoneme. Thus, the contrast is minimal. Here, word pairs are used that contrast the child's typical or error production to the target productions. Another way of kind of thinking about this is that the word pairs that are produced are homonyms by the child. Now, for maximal contrast, the minimal pair word set is contrasted by multiple features. Now, these contrasts differ in more than one way and may involve even up to all three of the features, including manner, place, and voice. Another way to kind of think about this is that while one word is the target or correct production, and the other word is the comparison or the child's incorrect production, in this approach, the child's errors are not used for comparison. Rather, a sound the child can correctly produce that is maximally different from the error sound is used for comparison within the word. Finally, for multiple contrast, the selection of targets is similar to the minimal pair approach, but differs in that minimal contrasting pairs for all or most of the child's errors are completed simultaneously. Here are some examples of possible targets using minimal pairs versus maximal pairs and then multiple pairs. In an attempt to make this easier for you, what I tried to do was be consistent with using the target word cap and then giving other possible target words rather than just giving you a variety of different ones. So read over those. Now let's take some time to review each of the phonological approaches in detail, starting with minimal contrast or minimal pair contrast, as both of these can be used interchangeably. You might also hear this approach called minimal pair intervention method, and like I said, all of these terms are basically talking about that same approach. Now, this approach is more commonly known and used when compared to the maximal or the multiple contrast approaches. Why? Well, because it is the older approach out of all three. So with it being the older one, more people know about this approach than some of the other ones. However, the trend is starting to change just a little bit based on more current research regarding these other two approaches of maximal and multiple. Now, with this approach, it is used most appropriately for children who have mild to moderate phonological impairments, and these kiddos typically display a few consistent sound errors or error patterns. This approach can also be used in both group therapy sessions as well as individual therapy sessions. And the general procedure consists of three areas. Those are perceptual training, production training, and then the complexity of the production is actually increased. Now, with this therapy approach, first, you could start out with perceptual or auditory discrimination training. Now, note that I said could, because this is not necessarily a required step. As we have discussed in some of our other lectures, to date, there is no compelling evidence. So let me say that again. There's really no compelling evidence to support this step. And other studies have shown improved results with production training or that practice only and not doing any of this perceptual or auditory discrimination. Now, if you do decide to do this step, what you're going to do is you would select word pairs that represent the target contrast. So depending on the age of the child, you would want to determine if these word pairs should just be written words or pictures, or maybe a picture with the written word down at the bottom to kind of start moving into some phonological awareness and even some literacy type skills. Then what you do is you're going to place both pictures that are within that word pair in front of the child and ask the child to point to the sun or point to ton. You would want to continue this until the child achieves that predetermined criteria that you already set. The second step is the production practice phase. And in this phase, or this step, is where the child is required to verbally produce the selected minimal pairs. So they're not required to do any verbal type of response within that perceptual or auditory, but here with that second step is where that verbal requirement comes in. Here the words are placed in front of the child, and as the clinician, you are going to model all the words, both the target and the contrast word, and then you ask the child to imitate to determine if the child is stimulable and can produce that sound/word using that direct model, right, or that imitation. Now, at this point, if needed, as we discussed earlier, the clinician can use the traditional approach to teach tongue placement, within that establishment phase for the child to get that correct sound if it is needed. To avoid not having to teach sound placement, then it is recommended that the child should be stimulable or show at least 40% correct imitative productions before initiating minimal pair work. If they are at that level, then next you would introduce the word pairs with the purpose being here the child is practicing saying the words spontaneously. Now the goal is to provide at least 20 trials of each of the target minimal word pairs. And within this phase or this step, you can incorporate different games to reach that number of trials rather than like a structured drill-like activity. Possible games, you can probably start thinking about those a little bit in your mind now, but possible games could include playing Go Fish, possibly doing like a memory game, playing Old Maid, maybe even like some sort of like an Arctic or minimal pair battleship, something like that. Now the last step is to use the minimal pairs in context. So here you increase the complexity of that response level from word, where we are at with that first and second phase. Now to like a carrier type sentence, such as I have a, and then whatever the picture may be. So I have a son, or I see a son. So overall, in summary, the goal is generalization. Here, generalization of the trained features to untrained words containing those same features is what we're really trying to get, as well as producing these features in conversational speech. Here is an example of using this approach within a therapy session. So first, if you decide that you're going to complete that perceptual training, you're going to do this by selecting 5 picture sets and ask the child to point to the correct picture, whatever it is you say. Now remember, as I said on the slide prior, this is only a receptive or listening task, as the child is not required to verbally produce the words. Here it's just mainly point to and them listening. Then you will move to that production practice, and at this point the child is required to produce the target words. Now first, we want to confirm and we want to make sure that the child can produce the target words. And once we have this confirmed and we know that the child can, we move to that spontaneous production of at least 20 trials. Now during this time, like I said earlier, you could play some sort of a game if you wanted in order to get those discrete trials. And lastly, we want to increase the complexity by using those carrier sentences. So moving forward, now let's talk about maximal contrast therapy. So this second approach could also be called maximal opposition. This approach is less common than minimal pairs, but is becoming more popular. This approach is most appropriate for children that have moderate to severe phonological impairments and have also multiple and even inconsistent error patterns, which is different from our minimal, right? Because minimal, we said more minimal to moderate type of severe with a few, and those sound error patterns or those sound errors being consistent. Now, with this approach, you're going to follow the same procedures that we just discussed within the minimal pairs. So, summary, the main difference is with the contrasting word pairs for target selection, not in the actual treatment, right? So here, the difference is in that target selection. So it's going to be more than one contrast, so not just one contrast of manner, place, or voicing, but here you're going to have more than one. So you might have manner and place, you may have manner and voicing, you may have place and voicing, and remember, right, you could even have all 3 of those contrasts being different. And last, the third approach is multiple contrast or multiple opposition. Now, this approach is most appropriate with those moderate to severe with those kiddos that have moderate to severe phonological impairments, similar to what I just said with the maximal pair therapy. Here you follow the same procedures, just like you did with the other 2 approaches, but once again, the main difference is in the target selection. So within this approach, you target all or as many as you can of the child's errors simultaneously. Here is a summary of those contrast approaches. So overall strengths of the contrast approach is that it is designed for children with multiple errors, and of course, it is also evidence-based. Research suggests that maximal contrast resulted in a greater change, and that greater generalization occurred when using more of the maximal contrast versus those minimal contrasts. Also, I gave you a copy of the actual table that is in your book on page 428, and with this table, then it shows the differences, or it contrasts those different approaches. Pay special attention more with the minimal pairs, the maximal oppositions, and the multiple oppositions. Read over just kind of what it says as far as with the empty set, but those top three are more of where you need to place your emphasis for this class. Now, in addition to the traditional, the concurrent, the cycles, and the contrast approaches, there are other approaches that we should probably mention just for some basic awareness, so you've at least kind of heard some of this terminology. These include the complexity approach, the stimulability approach, core vocabulary approach, the naturalistic speech intervention approach, and then we'll even look at some language-based treatment approaches. So with the complexity approach, it focuses on what is targeted, not how it is targeted. So more of our focus here is on what you are actually going to target, but not how you're actually going to go through and do the treatment. The goal of this approach is not to teach sounds in contrasting word pairs, like we just discussed with the contrast approach, but to select more complex target behaviors that could possibly lead to a wider phonological change based on generalization. So most recent research, or more recent, like even in 2001, indicates that target sounds should be later developing, so not those earlier developing sounds, but the later developing sounds, those sounds that are non-stimulable, possibly targeting clusters rather than individual phonemes, and target sounds that are more difficult for that child to produce. Stimulability approach. The goal here is to enhance the stimulability of sounds in very young children with severely restricted phonetic inventories. This is typically a short-term intervention program with the goal of increasing that child's phonetic inventory in preparation for another treatment approach. So this may be one of those approaches that you do early on to improve some of that stimulability. Core vocabulary approach establishes consistent word productions in children with moderate to severe functional speech sound disorders. Children here may produce inconsistent pronunciation of the same lexical items. Target words are then selected based on those that the child frequently uses more frequently. So maybe names, places, foods, etc. Strength with this approach is that it emphasizes, or that the emphasis is on increasing the child's immediate communicative success by improving production of misarticulated words that are made more understandable to immediate listeners such as parents. So here you're really emphasizing some of those core vocabulary or those key words that the child needs in order to become more intelligible or better understood by immediate listeners. Moving on, the naturalistic speech intervention approach. This approach has two phases. The first phase of this approach focuses on increasing the child's speech intelligibility for whole words through recasting and even acceptable word approximations. And then the second phase focuses on increasing the child's speech accuracy of selected sounds through recasts initially, followed by then moving into a more traditional articulation or phonological approach. So that first phase is targeting words and getting those more intelligible, even possibly as far as with approximations. And then once you kind of get that, then you move into that second phase, which is now taking it down more to that sound level. And the last one for us to talk about here are the language-based treatment approaches. And the primary focus is looking at and targeting both language and phonological skills at the same time or simultaneously. So, as we discussed at the beginning of the semester, we know that there is a high correlation that a child that has a speech sound disorder, specifically a severe speech sound disorder, may also have deficits in those areas of phonological awareness, literacy, and even language. So it is suggested for us to target both language and phonological skills simultaneously. However, there's always one rule, and it's not always black and white. But if that child is unintelligible, it may be more productive to work on speech sound production prior to working on language, because if they're so unintelligible that you can't understand what they're saying, then it's going to be hard to target some of those language skills. Let's get those speech sounds going, improving their overall intelligibility, and then begin to focus on the language. Last but not least, oral motor exercises. So here, I guess, to do or not to do those oral motor exercises when working on speech production has been, will be a hot topic, and it consistently continues to be a huge debate. Many believe that children should be offered oral motor exercises without any sound production attempts, or you should work on oral motor exercises before trying to get them to actually verbally produce those sounds. However, there still is no evidence to support this belief, or thinking that working on oral motor and working on some of these exercises will improve that child's or that client's ability to produce the sounds. So that is the end of this PowerPoint. Review the video that is also listed under materials. That kind of gives you kind of a good snapshot of what a contrast approach therapy session looks like, and will also be something that that I would suggest that you kind of use or look at while you are completing your contrast assignment that you have for this module.